YouTube channel. I am Dishita Solanki and I am TYBPT student in Marwari University. Today in this video we are discussing about the internal genital organs of the female. So, female's internal genital organs are vagina, uterus, fallopian tube and ovaries. First, discussion about the vagina. Structures of the vagina. It is the fibromuscular tube-like structure. It extends the cervix to the external genital organs. It's located between the bladder and rectum. Function of the vagina. It's allow to passage of menstrual flow. Second, pathway of the baby. Length. The anterior wall is shorter than posterior wall. Blood flow of the vagina. Blood flow is the internal iliac artery and vein is internal iliac vein. Relation of vagina. Anterior relation with urinary bladder and urethra. Posterior relation with anal canal and rectum and retrograde relation with ureters. Nerve supply of the vagina is pudendal nerve. Next, internal genital organ is uterus. Uterus is hollow, pear-shaped like muscular organ. Uterus is divided into three parts: fundus, body and cervix. Fundus, in no cavity is present. Body, in which triangular like cavity is present. Cervix, fusiform like cavity is present. Cervix is divided into two parts: supravaginal part and vaginal part. Uterus is made up of the endometrium, myometrium and perimetrium. Uterus is weight is 50 to 80 gram. Position of uterus. Uterus is anteversion and anteflexed. Anteversion uterus position. It is long axis of whole uterus is bent forward on long axis of the vagina. It is the anteversion position of uterus. Anteflexed uterus position. It is long axis of body of vagina is bent forward on long axis of the cervix. It is anteflexed uterus position. Blood supply of the vagina. It is uterine artery and uterine vein. Nerve of uterus. Nerve supply of the uterus. Inferior hypogastric plexus. Next internal organ is fallopian tube. Fallopian tube is 10 cm long. Fallopian tube is enclosed into the broad ligament of the uterus. Fallopian tube is divided into four parts: intramural part, isthmus, ampulla and infundibulum. Intramural part, it opening into the uterine wall. Isthmus is narrowest part of the fallopian tube. Ampulla is widest part of the fallopian tube. In infundibulum part, it's funnel-shaped end in which finger-like projection is present. It's known as fimbria. Is related to ovary. Function of fallopian tube. Transport of gametes to facilitate fertilization and the survival of the zygote. Its secretion. Blood supply of the fallopian tube. Uterine and ovarian artery and ovarian vein. Nerve supply of the fallopian tube. Ovarian and uterine nerve. Next, internal organ is ovaries. Ovaries are two almond-shaped bodies. It is lying in the fossa ovarica on the lateral pelvic floor. Its measure about the length is 3 cm, breadth is 2 cm and thickness is 1 cm. Each ovary presents 2 ends, 2 borders, 2 surface. 2 ends is tubule and uterine. 2 borders is mesovarium free posterior and 2 surface is medial and lateral. Functions of the ovary: produced the female sex hormone estrogen and progesterone, is the release of eggs. At birth, ovaries produced 2 million follicles. Ovarian hormones prepare the uterus to the implantations of the fertilized blood supply of the ovaries, ovarian artery and ovarian vein, and nerve supplies of the ovaries. It is the ovarian flaxes. Thank you.